My name is Dr. Mohammed Rela. I'm a consultant liver transplant surgeon at King's College Hospital, Dubai. We did a very exciting operation on the 7th of May, 2025. This was done for a 4-year-old child with a condition called Crigler-Najjar Syndrome. Now, Crigler-Najjar Syndrome is a metabolic liver disease, which is an inherited disease which runs in families. These children are jaundiced from birth, and their jaundice level goes up to beyond what we call acceptable range, which is sometimes up to 25 milligrams. The danger for these children is the jaundice level reaching that much causes brain damage. So these children, in order to prevent brain damage, have to be under a light for at least 10 to 12 hours a day. And it is very restrictive for these children to lie under a light for 10 to 12 hours a day. And it is very restrictive for the family because they can't take these children anywhere because they have to be back home in the evening to put them under light. And liver transplantation cures this condition. Now, most often, the liver transplant will involve removing the whole liver and replacing with a cadaver or a living donor organ. And here we did a living donor liver transplant for this child. And we did something very unique. Again, unique because this is not an operation which is commonly done. Unique also because this is the first time such an operation has been done in UAE. We did a procedure called auxiliary liver transplantation. The auxiliary liver transplantation is where we keep part of the child's liver. Half of the child's liver is with the child. Normally in a transplant, you remove the whole diseased liver, but we kept half of the diseased liver and we replaced it with another half from the mother. The mother has a normal liver, and this will immediately correct the metabolic abnormality, and the bilirubin levels will fall to normal within 2 to 3 days. And 1 day after surgery, the child doesn't need phototherapy any longer. So it's a freedom from phototherapy and also prevention of any brain damage in the future. So that is the idea. You may ask, why did we keep half of the child's liver? Now, science is developing rapidly, and this condition in the future, we hope, will not need liver transplantation if gene therapy comes into effect. And there is a huge amount of work going on for gene therapy for these metabolic conditions. And if gene therapy becomes available, then this child's own liver is needed for gene therapy. And then the child doesn't have to have the mother's transplanted organ, and we can stop immunosuppression. So all patients who have liver transplant have to remain on these drugs called immunosuppressive drugs in order to prevent rejection. And long-term immunosuppressive drugs also have side effects. Even though we now can monitor them for side effects and manage them effectively, nevertheless, these are children who are 4 years of age who are likely to live for another 50 to 70 years. Who are we to say, if you're not careful, those side effects may creep up? Now, if gene therapy is possible and if it can be given, the child will become just like any other child without the need for lifelong follow-up, without the need for lifelong immunosuppression. So that is what is very unique about this operation that was conducted for the first time in UAE.